The Science of Motion Forum on Navicular Syndrome with Jean-Luc Cornille, Dr. Elizabeth Uhl, DVM, PhD, DACVP, and Dr. Michelle Osborn, MA, PhD. The medical world attributed hoof lameness to strain in the coffin bone. In 1752, Joseph Bridge demonstrated that the culprit was a small bone situated behind the coffin bone and named the distal sesamoid, or navicular bone. In 1890, the USDA posted a reprint of previous editions, emphasizing the role of the horse's body loading, the forelegs, in the development of avicular syndrome. It must be remembered that the forelegs largely support the weight of the body when the animal is at rest, and that the faster he moves, the greater is the shock which the forefeet must receive as the propelling force of the hind legs throws the body forward. This shock could not be withstood by the tissues of the forefeet and legs were it not, but it is largely dissipated by the elastic muscles which bind the shoulder to the body, the ease with which the arm closes on the shoulder blade, and the spring of the fetlock joint. Even these means, however, are not sufficient within themselves to protect the foot from injury, so nature has further supplemented them by placing the coffin joint on the hind part of the coffin bone instead of directly on top of it, whereby a large part of the shock of locomotion is dispersed before it can reach the vertical column represented by the cannon, knee, and arm bones. A still further provision is made by placing a soft elastic pad, the frog and plantar cushion, at the heels to receive the sesamoid expansion of the flexor tendon, as it is forced downward by the pressure of the coronet bone against the navicular. Extraordinary as these means may appear for the destruction of shock, and ample as they are when the animal is at a slow pace or unweighted by rider or load, they fail to relieve the parts completely from concussion and excessive pressure whenever the opposite conditions are present. The result, then, is that the coronet bone forces the navicular hard against the flexor tendon, which, in turn, presses firmly against the navicular as the force of the contracting muscles lifts the tendon into place. It is self-evident, then, that the more rapid the pace and the greater the load, the greater must these contending forces be, and the greater the liability to injury. The Science of Motion's approach to navicular syndrome primarily focuses on the intensity, direction, and frequency of forces loading the horse's lower leg from the body. The 27 cases of navicular syndrome that we have rehabilitated all presented with a spine dysfunction, loading the right or left front leg abnormally. Soundness was restored, ensuring proper hoof balance and correcting the spine dysfunction. The horse in the video was lame and diagnosed with a severe navicular issue. He regained his soundness and an active life, both in the training ring and in turnout. We are opening enrollment for a unique 3-month private online group with Jean-Luc Cornille, Dr. Elizabeth Uhl, pathologist researcher, and Dr. Michelle Osborn, functional anatomist. Starts October 1st, 2025. Dedicated to navicular syndrome, this is more than a lecture. It's an interactive mentorship where you will learn to understand navicular from the inside out, prevent common mistakes, and apply biotesigrity that truly protects the horse. Submit your horse's case for potential case study review. Question and answer sessions included. Private online discussion group. Supplemental readings and video materials. Understanding Navicular starts October 1st. Registration starts now. Exclusive learning opportunity on navicular syndrome. Healing happens in motion. Understanding happens together. The Science of Motion team. Visit scienceofmotion.com.